WHO is committed to improving healthier living of Africans. Globally, a contaminated environment is considered as one of the major risk factors, contributing to 23% of deaths, which is approximately 100,000 per capita, as a result of the poisonous substance associated to refuse dumps in the country. In light of this risk, the World Health Organization, in collaboration with the United Nations Environmental Programme, had its third interministerial conference on health and environment on the 5th to 9th November 2018 in Libreville, Gabon, seeking ways to identifying the emergence of environmental threats to people's health and develop strategic action plan across Africa. However, this environmental death in Africa and Nigeria in particular is being linked to lack of access to safe drinking water, inadequate sanitation and poor infrastructure, pollution, new environmental threats such as climate change, rapid and unplanned urbanization, and dumping of refuse close to people's surroundings. Our correspondent, who visited some of the densely populated areas in Pape, Buari Area Council of the Federal Capital Territory in Nigeria, report that the environment was not conducive with the citizens living around the vicinity due to the huge lump of refuse dumped close to the populace. According to the WHO, Regional Director for Africa, Dr. Mechiso Moeti, the water people drink and air they breathe, as well as where they live and work, is greatly affected by 1 in 4 of illness that may result to death in Africa and beyond. However, calling for adequate financing across regions to urgently address health-related issues that are linked to environmental challenges in Africa. At Pape in Buari Area Council, Mr. Korinjo Dominic and Abigail Gugu, whose house are close to the refuge, said they are being affected by the toxic waste. Hence, much work is needed by the environmental agencies to address the ugly trend.
The environment has a profound impact on the health of people in Africa, as it does all over the world. It's through the air people breathe, if it's contaminated, through water and sanitation, and through climate change. And it affects, in Africa, we estimate almost 1 in 4 of illness in the region. 10 years since we held the first conference here in 2008, and I believe we have done a lot. First of all, we've established within the United Nations a very strong partnership between WHO and the United Nations Environment Programme. And together we've managed to work at the country level with ministries and sectors of health and environment, have helped them to establish a common platform in some countries for joint analysis of risks, of vulnerabilities, and also development of joint plans. Clearly, the mechanisms have been put in place, the tools have been developed, and a lot of experience has been gained. One of the observations that we make is that the financing has not been available to the extent that it could have been to scale up some of these interventions that have been discovered. So one of our strong expectations now is that with this experience of 10 years, with the lessons that we've learned about what works, and with the opportunities offered by some of the financing mechanisms that have sprung up in the last few years, we can go much further.
Papa, generally, honestly, it's the environmental agencies are not doing the needful. As you can see, the refuse piled up just beside the road. It's not supposed to be like this. It's not good for, it's not hygienic. And I'm calling on the government agencies to do something about it. We are human, we are not animals in the bush. An environment like this is not conducive for people to live in. I think it would be very nice for any organization to take care of this, if there is anyone at all. Because presently, not only here, move around this our environment here. There are gutters and very, it's not healthy at all. I must be sincere. The environment is not good. It's not hygienic. So definitely, a lot of things will happen. Diseases, sickness, and what have you.
It has really been affecting us because we live around here, and There are many houses around here, many people are living here. In fact, Pape is very populated. We need the government to come to our aid because this dirty around here is really affecting us. And it's driving some of the people living around here because this type of dustbin is not good for the health. It can damage the health. It's not good for human beings to inhale. It is really bad. It's really bad.
Well, we expect that this conference will galvanize more synergy between the ministries of health, environment, water resources, in order to be able to tackle disease burden arising from environmental linkages, particularly waterborne diseases, vector-borne diseases, and the new problems arising from chemical pollution of soil, water, and air. The Ministry of Health, we know that if we're able to take care of diseases that are connected with the environment, the disease burden is reduced, health expenditure is reduced, and in fact, most of the problems that the Ministry of Health takes care of will be reduced. So we will now be more concerned with other diseases that have less to do with the environment, that do not require so much resources. My view is that prevention is cheaper than care, particularly primary prevention, which it's all about here in this conversation at this event.
Buhari Area Council in Pape, where the people are crying for help. They said they want the government to come to their aid because they are tired of the smelling odor they have been receiving on a daily basis. According to them, they said it's a good thing that we came on the dry season, that if it were to be on a rainy season, we will not be able to be in this place. So they are calling for help. They want civil society organizations, United Nations, any agencies to come to their aid because they are tired of this vicinity. I am Vincent Okushi.